Well, you just saw that spot for Alignment Healthcare, and I'd like to welcome on a couple guests from Alignment Healthcare for the first time that you folks have been on. First, I'd like to welcome Christina Simons. You are the Vice President of Sales.
Yes, I am. Thank you very much for having us today.
Yeah, great to have you here. And Dr. Arda Bakshande, and you are the Senior Medical Officer.
That's right.
For Alignment Healthcare.
Thank you for having us.
Pleasure to have you both come on. First, I'm going to go to Christina. And what is Alignment Healthcare?
Alignment Health Plan. Actually, we're homegrown right here in Orange. And we offer Medicare Advantage HMO and HMO special needs plans for Medicare eligibles. We currently service for next year 8 counties, including right here in Orange. And what makes us very unique and different is, in addition to our rich benefit offerings, we actually combine that with a very unique delivery of care model, which actually Dr. B here can definitely describe in more in detail.
Tell me all about that.
Sure. So, you know, we're about 5 years old, and when I came on about 4.5 years ago, one of the things that we talked about was how do we create a model of care that's really built around the senior. And so I took my experience not only as a physician, but watching my mother, my uncles, and my aunts take care of my two, at the time, 92-year-old grandmothers who are now 96. You know, it was interesting to see how the dynamic in healthcare is so difficult as we age.
Yeah.
And so we built a healthcare platform really centered around seniors to be able to go into not only the home to see patients if they need to be seen there, or provide them with services to bring them to their doctor's appointments, pharmacy, wherever it might be, partnering with people like Lyft or Uber to get them, get them a ride to be able to come into the pharmacy if they're not able to drive. And so it's really built around the idea that we should put the patient before anyone else. And if you do that, good things happen for everybody.
And that's a concern for a lot of folks, for seniors, is that getting to the doctor or the specialist or whatever the testing that needs to be done is often quite difficult.
Absolutely.
And this is where you folks kind of help that need, right?
Yeah, I think in a lot of ways we look at what are the barriers to care and things that you might need. So we offer case managers, social workers to all of our members that if they can help coordinate their care with whoever it might be something as simple as helping them get that ride that they need. And moving forward and making it a lot easier. And I think, Christina, you can talk a little bit about our new programs where we're able to, with one call, really solve most of the issues that patients have. So I don't know if you want to talk about that.
Absolutely. And we're going to roll out the buzz about our new access, which is on-demand personalized care. It's actually a concierge opportunity for our Medicare members. Basically, in addition to their member ID card, we're actually going to be providing all of our members with this black access card. And what it will allow them to do is basically 365 days of the year, 24 hours in the day, 7 days a week, access to speak to a live representative and help them navigate through their services. So how do they access their transportation, their vision, their dental, their post-discharge meals, all the things that they may need help and assistance with. The second thing that the card does, which we're really excited about rolling out for 2019, is 24/7 access to a doctor. So we will be rolling out a telehealth opportunity.
You're be up a lot, okay?
I'm already up.
All right.
Exactly. But we also have a rewards program where this will actually be able to be used as a credit card as well. So they'll be able to go into select pharmacies and be able to load that on. So
very nice.
We're super excited about that.
Now, you mentioned a couple things. One is navigating this system because this isn't like, years ago, you basically had your doctor. It wasn't even called a primary care provider. It was your doctor.
Yes. Right.
You had your preferred hospital. And that was about it, and whoever was your insurance company. A lot more difficult today with the different programs that are out there. And it's hard for folks to navigate through that.
And I think that's why you need someone to help you through it. Not only people who, like myself and watching my family, go through the pains of coordinating care, but having a clinical team that actually understands that. It's very personal to us, and creating a model that we don't want you as a patient to go through that, because it's the last thing I want you to worry about when you're ill.
Yeah.
You're already sick. You don't need to worry about how do I access what needs to be done.
Yeah.
And so by creating a level,
true.
Someone you can trust, really, that you call, that person knows about you, knows your healthcare information, and can help you navigate to where you need to go quickly, timely, and in a way that you not only deserve but want to be treated is also really important.
Yeah. And you mentioned special needs, because there are programs out there, and if I'm correct, people who might be diabetic or...
Correct.
I think there's 3 or 4 of them, right?
Correct.
Yeah.
So actually in Orange, we actually have multiple products, and depending on the type of condition for that senior, we'll put them on the plan that's best for them.
Yeah.
So we do have a regular traditional plan that will be the most popular, obviously, during the annual enrollment period, which is October 15th through December 7th.
Yeah.
We also have HMO special needs plans designed for folks that have either diabetes or a heart condition. We also have a product that's designed for folks that are full Medi. That's the folks that have Medicare and Medicaid assistance.
Oh, okay.
So low income subsidy.
Okay. And one of the things that, I mentioned years and years ago, it was easier to navigate the system. However, years and years ago, they didn't do what's now called wellness or preventative type medicine. Right. It was more reactionary. And now we have the technology to, in many cases anyway, to be able to kind of look at the future and what that person may or may not have to look at and be concerned about, right?
Yeah. I'm actually glad you brought that up. So we were doing something, it's been a project of mine for the last 4 years, and I have a team that I work with on a daily basis where we've created what we call our clinical command center. And what this does is it looks at the patient's healthcare data, their pharmacy information, their diagnoses, the hospital they may have gone to, lab information, and the computer actually goes through and to make it very simple, it kind of predicts what's likely to happen next in terms of either your disease state of diabetes is getting worse or might get worse. And it actually triggers an alert and sends it to a case manager or a nurse so that they can intervene and say, hey, this is what's going on. And I'll give you a really simple example is we've done very well on pharmacy adherence because we actually have this running, again, on a daily basis. It refreshes every 15 minutes and looks for, if you missed your medication, what's going on. So you didn't pick up your prescription or the prescription has a gap. We know that if you're a diabetic and you miss taking your insulin for a period of time, not only is your blood sugar going to get higher, but there's long-term effects of the diabetes. But we actually have a pharmacy team that's looking at these alerts every day on a minute-by-minute basis and then calling members and saying, hey, what's going on? Do we need to help you get to the pharmacy? Is that the problem? Is it that you don't need a refill, or you need a refill but your physician wasn't able to do it? We'll actually connect you to the doctor so we can get that done. Or is it easier for us to do mail order and actually have it mail order to your home so you never have to leave the home and your pharmacy benefit can be done and brought straight to you in a 90-day supply at home, to really make it more convenient for you as a patient to not have to go out of your way to worry about your health care. And
you also have a program where you can help homebound patients. And I did mention that for some folks getting out, but they're still able to, it's the transportation. They can still get out, it's just finding a way to do it. But there are folks that are primarily homebound for whatever reason. And so, again, is speaking from experience and looking at my own family, is I do have a grandmother that's homebound, and how important it is for her to see a clinician, and lucky for her, she has a grandson who's a clinician who can come and see her, but not everyone has that. So we need to be able to provide care in that way for our population, and that's why we built our home-based program. To allow not only nurse practitioners and PAs to go into the home, but physicians and RNs, health coaches, to really help on the idea of wellness. I think we call
healthcare in this country healthcare, where in turn it's actually really sick care, and we wait for people to
That's
get
right,
sick.
yeah.
But we should really be striving towards the health of our membership, and that's what we're really trying to do.
All right, very good. Again, folks, enrollment begins in, is it today? Is it
No,
Monday?
it's
Monday this
Monday.
15th
Monday.
to December 7th. And of course, when you're looking at any program, you want to look at the formulary if you're taking certain drugs and how it fits in. And you can find out if it's right for you. But folks,
Absolutely.
I want to thank you
Thank
for
you so
both
much for
coming
having
on
us.
today. And if you want more information, you can go to alignmenthealthplan.com. There's a number on the screen as well, 888-979-2247. I'd like to thank Christina and Dr. B for coming on today. That's a little bit easier for me to say,
Yeah, it's
if you don't mind.
That's what I tell everybody to call me.
All right, thank you, sir.
Thank
Take care.
you.
Thank you very much.
Again, a pleasure. Thank you.
We'll be right back. You know, it's